During the pandemic, we've repeatedly heard healthcare professionals begging for more hires and more beds. But a doctor in Saskatoon thinks we should instead be focusing on addressing bigger issues that are contributing to the backlogs in hospitals. Dr. Chris Christensen is a pediatric resident completing his training at the Jim Pattison Children's Hospital. He joins me now. Hello, doctor.
Hey, Natasha, nice to meet you.
Thanks for joining us. You compare this current state of healthcare to a traffic jam. What exactly do you mean by that?
Yeah, I think the traffic jam analogy is it's a fair one, kind of considering what we're currently experiencing. But the essential components of it are is that someone gets kind of stuck in a situation at the front of the traffic line, and it presents as kind of a rippling effect, where the further on down the line you are, the greater the delay becomes. And the problem for the person at the front is really that if you're kind of trapped, you don't have anywhere else to go. The line itself is only kind of giving this imposing pressure to proceed forward, but really there's no easy answers. And instead, the answers are trying to prevent the traffic jam in the first place, which I think is something that we need to focus a little more on.
And in healthcare, if you can spell it out for us, what is that traffic jam?
There's a fair number of preventable illnesses that we're seeing an increasing prevalence of. They range from everything from like prenatal care,
You don't have
ensuring
tests,
that
or
every segment of the population has access to that, as well as the immunization difficulties that we're currently having, and really just the preventable illnesses that are becoming more and more frequent and are consequently kind of um, taking up a disproportionate amount of time that could be better spent kind of in more acute issues as well as to these chronic recurrence of issues that develop.
and what would help alleviate that traffic jam or prevent it from happening in the first place in your mind?
There's a lot of answers to that question. Obviously, more staffing, more occupancy availability would be huge. I think the big one and the one that's lacking the most recently is ensuring that everyone has access to good healthcare, ensuring that there's not as much misinformation floating around about things like vaccinations, things like prenatal care, and ensuring that really that the path forward is clear to people. I think the more time goes on, the more obscured in falsehoods some of the truth becomes. And I mean, it's easy for some of us to navigate because we've kind of been given every benefit possible where we understand long-term consequences and outcomes, but it's not like that for everyone. And I think, pardon me, I think until we realize that, we're going to end up in this kind of continued pattern of people being disproportionately affected depending on their socioeconomic status. And that's something that we really do need to start looking at.
What you're suggesting is very important, of course, but it's not the first time we've heard these calls to tackle deeper issues like poverty and addiction, these social determinants of health that you're referencing. So why do you think this isn't happening, and what more needs to be done?
I think a lot of it is because with the advent of misinformation kind of clouding so much of the internet, our media outlets, things like that, it's just becoming more and more of a problem. And so it's kind of continuing to build and to climb, and we're starting to see the effects. Like our healthcare system was robust enough to kind of manage these things for a long time, but we have to kind of recognize that we're at a kind of limit as to what we can safely manage. As to why it's not happening, I think it's a lot to do with the political landscape. I think people have different opinions, and I mean both sides, left and right, are both kind of extremists, and those extremes of opinions end up conflicting and negatively impacting everyone in a similar way. In that you're we're not kind of uniting as a community as we need to. I think until we kind of do unite as a community and kind of put aside some of our biases, that we're going to continue to be affected. So the greater the division becomes, and however it's sowed, whether it be through, media landscapes, political landscapes, interpersonal landscapes, that division is just going to continue to grow. And what I really want is just for us to kind of recognize that we're all part of the same community, and our actions have consequences that we don't always necessarily see, but are nonetheless felt. Um, and until those are kind of more on the forefront of our mind, we're going to continue to feel those things, and all of us are going to continue to be affected.
Thank you for your time.
No, my pleasure. Thank you.
Dr. Chris Christensen is training at Jim Pattison Children's Hospital in Saskatoon. You can read an opinion piece he wrote on our website at cbc.ca/sask.